pleasure to welcome all of you to this conference today. The conference is going to be this afternoon and all day tomorrow, so I hope that you'll be able to be with us for the whole event. The event that is sponsored by several different organizations, including a grant that the Texas Public Health Association received from the American Public Health Association to help us further the cause of accreditation in Texas for local health departments. So we're very grateful for that. In addition to that, we were partnered by the Texas Association of Local Health Officials and by the University of North Texas Health Science Center School of Public Health and by the Texas Public Health Training Center. So we're very excited to have all of you here, and each person is going to come up from those agencies and just do a little welcome and what that means to them. For me, as a local health department worker, as well as being the president of TPHA, this is a major effort that we hope to be undertaking in the next several years. We would love to have our local health department accredited, and yet when you start looking at the process, sometimes it's a little bit, maybe a little bewildering perhaps, and maybe a little challenging in the midst of everything else that we have to do on a daily basis. I'm not sure how many of you have been tied up with 1115 waiver or West Nile virus or all the other challenges of this year, but it's really hard to put something else to the forefront that is important to you and to your department. We had a great conference here a year ago that TPHA and TALHO put on last year. And at that, it was exciting to hear the possibilities and the reasons behind accreditation. So many of our partners in the healthcare field and in other arenas have accreditation that they apply for and can show the world we do things the way we think they should be done. And it's an exciting time for public health to be able to say the same thing with a national accreditation process. So I'm glad that all of you are here. Just a couple of housekeeping announcements. There will be some refreshments out at the table, and we'll have a brief break to be able to take part of that, but we're all grown up, so if you need to go get something or you need to go to the restrooms, they're straight behind that wall. I think if you go straight that way. If you need anything else, we do have someone sitting at the registration desk out front, and also the UT Commons has someone across the way there that can help you with other issues too. So if you need anything, please don't hesitate to ask. I'm going to just briefly overview the conference. We have the welcome right now, but then we're going to turn it over to this wonderful panel of experts over here this afternoon. They're going to talk to us about data gathering for your community health assessment and community health improvement plans. And that will go until 5 o'clock this afternoon. We will reconvene tomorrow morning, and we have a session at, 8 o'clock for registration and picking up materials, but 8:30 the session will start in this same room, and that will be talking about facilitation of community, how to bring your stakeholders together and how to work with them to get buy-in, and a process that you can use very simply in your own communities to help further this process along. And that will break up into 2 sessions so that we can have a little bit more hands-on practice during that in the session tomorrow. Then in the afternoon, we're going to hear from some people that are moving along with the processes of the community health assessment, community health improvement plans, and they're going to give us some insight into the things that they have done, best practices, things that we can all use in our own health departments. We also have speaker Teresa Dahl will be here tomorrow from CDC. We're glad to have her here. So that's basically, the meetings will go till about 4 o'clock tomorrow afternoon. We will have a wrap-up at the end at 3:30, which we hope everyone will attend so that we can get some next steps to move forward for next year. So, without further ado, I'm going to introduce the head people from our sponsors for this conference, each of whom will come up in order to welcome everybody and talk a little bit about why their organization is involved. So the first person will be Mike Hill, who is the brand new CEO for the Texas Association of Local Health Officials. We're glad to welcome Mike here. And then Dr. Richard Kurz, who is a professor and dean at the University of North Texas in the Health Science Center School of Public Health. And then Dr. Lloyd, who is the associate dean for public health practice, University of Texas School of Public Health, and also the director of the Texas Public Health Training Center. So without further ado, if you'll just follow up.
Okay, thank you, Kaye, and welcome everybody. I think what this conference is a good example of is the way that we're successful in public health by working together. As you can see, we got 4 organizations sponsoring this that are kind of diverse organizations all coming together to try and help you all with funding from APHA. They couldn't come in person, I guess, but they sent the check, so that's a good thing. You know, in public health, the greatest successes I've seen over my career is when health departments have come together to work on projects. When I was in Florida, I was on the governor's hurricane response team, so a bunch of health departments would come and respond to a hurricane, and things got better. I watched other places where the health department director thought he was like, you know, the big macho man and he's going to do it himself. Bad times. So I think that's a key, is working together, coming to places like this, sharing your successes, sharing your opportunities for improvement, helps all of us do better to get our health departments accredited so that we're able to do a good job for the people of Texas, to keep them healthier, and to get the money that'll probably come with accreditation in the future. So that was my short soundbite. I was told to be under 2 minutes, and I think I did that. So have a great conference.
Okay, I don't think I told him 2 minutes, but that's what he wanted to do. So anyway. Okay, and now Dean Kurz.
I'm going to try not to take very much longer than that as well. I just, on behalf of the University of North Texas School of Public Health, wanted to welcome all of you and thank you all for coming out for this event. I think it's another meaningful step as we move along that course, which I understand is anxiety producing sometimes in terms of going for local public health accreditation. Special thanks, and I'm sure we'll do this over and over, but go to Terry Pauley and Jennifer Smith for all the leadership that they provided to get this conference to be here today and to be the excellent conference that I'm sure it's going to be. Also wanted a special thanks to go to the State Health Department. They funded a contract about a year ago that is helping to provide resources for local health department accreditation. And some of you may have already seen one of the results of that, which is a survey of all the participating health departments in the state, or a large sample of all the participating health departments in the state, that gave us really a readiness assessment of where we are at this point in time, and a lot of ideas about what needs to be done to move that process along for the local health departments. And if anyone would like a copy of that, or indeed some other things I'm going to mention here in just a minute, I'm sure in time you will be able to have that. Certainly with the readiness reports, you can have that anytime you like. If you don't have one, I'd be happy to send you one. The contract will also produce, in addition to that readiness report, a master plan for the state for accreditation, which has a number of aspects to it, and I'm going to just touch on one of those in just a minute. There will also be a toolkit to help. I know that process of getting in there and looking at things like the FAB website or the NACCHO website, a little daunting, and we're trying to put together a quote toolkit that will help to direct you to some of the places that are easier to get started, some things that make that whole process a little simpler from the beginning, hopefully to take down that barrier, at least to some degree. This conference is in part funded through that contract, and so I think that's important to recognize as well, and we thank them for doing that. One element of that support, which is recognized in the plan as well as in the toolkit to some degree, are the schools of public health, and I say plural, schools of public health, because I think Houston and A&M and ourselves all can be contributors to this. We are all parts of the training center, which Linda's going to tell you about in just a minute, and those are resources that we need to and should bring to bear. We're there to serve the people of Texas, and this is an important way that we can do that. I think we can link up to our internship programs, our field experiences, whatever we call them. It can link perhaps in some ways to the courses we offer and the training that we're doing of students. We have certificate education. I think the other schools do as well. That's online or in other forms. Ours is online. That can help provide some education for folks to be a little better prepared for this. So all of those sorts of things are really essential, I think, if we're going to bring to bear all of the resources that we can have locally, regionally, statewide, even nationally, to facilitate this process in Texas. So just will conclude by saying again, thank you for all coming out and participating in this. Any way we can be helpful, we're happy to do that. And I look forward to a really productive couple of days here and take a next step to getting accreditation done for all of the health departments in Texas. Thank you.
Dean Kurz, when you get that toolkit, I hope it's all written in Texas language so we have a few y'alls in there, we can get it done, okay? Make it easier. And now Dr. Lloyd from UT School of Public Health in Houston.
Good afternoon. I'm Linda Lloyd, and I may work at the University of Texas School of Public Health, but I'm here this afternoon to welcome you on behalf of the Texas Public Health Training Center. The Training Center is a consortium of the 3 schools of public health. As Dean Kurz mentioned, University of North Texas School of Public Health, Texas A&M Rural School of Public Health, and then UT School of Public Health. We're rather unique, and we're the envy. You know, Texas isn't often the envy of anybody, but for some things they are. And we are as one of the only state that has all 3 schools, or all schools within that state working together. One of our major goals are needs assessment and trainings. Workforce development is about what we're all about. We've been working with some people here in the audience this afternoon already, but we're here to say that the Training Center is a resource that is available to you, one that would come not only with our own knowledge within the 3 schools, but also we're part of a national network, which would allow you to have access to trainings that are happening across the country. So I'd like to get to know more of you. I don't know many of you in here. I'd like to get to know you, and I'd like to be able to share with you what it is that we can offer as a Texas Public Health Training Center, and do enjoy your little Rubik's Cube, and always remember who we are. Thank you and welcome. I look forward to a great conference.